Hi guys, Dr. Kid here. In this video, I'm going to do a review of the weight loss medication Liraglutide. I'm going to tell you how it works, how to take it for the best results, what are the key side effects to look out for, and how effective is it actually for weight loss. So what is Liraglutide? Well, Liraglutide, commonly sold under the brand names Saxenda or Victoza, is a once-a-day injection weight loss medication. And what it does, it mimics a hormone in our body known as the glucagon-like peptide 1 hormone, or the GLP-1 hormone. This hormone is responsible for regulating our appetite, and it helps with weight loss by suppressing our appetite. The GLP-1 hormone also stimulates our pancreas to produce a hormone known as insulin, and insulin helps to lower our blood sugar levels. So how do you take it? Well, liraglutide is a once-a-day subcutaneous injection, meaning it's an injection that goes just underneath the skin, and it can be given in the abdomen, thigh, or upper arm. The starting dose of the medication is 0.6 milligrams a day for the first week. If you notice no side effects after the first week, then you can increase the dose by 0.6 milligrams per week up until a daily dose of 3 milligrams. 3 milligrams a day is the ongoing recommended dose. So what kind of weight loss might you expect from liraglutide? Well, I'd like to share with you 3 studies where patients were randomized to either receive liraglutide or a fake version of the medication known as placebo, and in all these studies they also did it in conjunction with dietary and exercise advice. The studies went on for 56 weeks, and the daily dose that was given was 3 milligrams, after starting with 0.6 milligrams in the first week and ramping up to 3 milligrams after 4 weeks, as I described previously. After 56 weeks, the patients that took liraglutide, the average weight loss of the 3 studies were 4.9%, 5.4%, and 7.4%. As you can see, this was roughly 4% higher than their corresponding placebo groups. Now obviously the results can vary widely, and the amount of weight loss can depend on multiple factors. Some of these factors might include how a patient responds to the medication, what side effects the patient experiences, and how dedicated they are to diet and exercise changes. But this gives us a good idea of what you might expect if you took this medication for 1 year. By the way, it would be greatly appreciated if you can like and subscribe to the channel. It'll let me dedicate a lot more time to making more content like this. So what are the side effects of this medication? Well, the most common side effects of this medication includes nausea, diarrhea, constipation, vomiting, and irritation at the injection site. I've also listed in brackets what percentage of patients actually experience this side effect when they're taking liraglutide. As you can see, by far the most common is nausea, and in clinical practice, this is the reason most commonly patients stop the medication for. This is also one of the key reasons why we slowly ramp up the medication to make sure that the patient isn't experiencing any major side effects. There are some rarer but more serious side effects to consider when taking this medication. The first of which is a potential increased risk of thyroid cancer. In studies of these medications with rats and mice, there was a dose-dependent increase in the incidence of a certain type of thyroid cancer. However, this has not been replicated in human studies at this stage. Despite this, it's still an important consideration when taking this medication. The second rare but potentially serious condition is pancreatitis. This is a condition where you get inflammation of the pancreas, and this is the condition that can range from a very mild disease all the way to being fatal. The key signs and symptoms include upper abdominal pain that can radiate to the back, that can be associated with nausea and vomiting. The incidence of pancreatitis in patients taking liraglutide was approximately 0.3% compared to 0.1% that were taking placebo. The third rare but potentially serious side effect is acute gallbladder disease. This includes gallstones, otherwise known as cholelithiasis, and gallbladder inflammation, otherwise known as cholecystitis. The symptoms of these conditions are, for gallstones, you get right upper abdominal pain that can be associated with nausea and vomiting. If it develops into cholecystitis, which is typically a worse condition where there's inflammation of the gallbladder, the symptoms may then include fever and just feeling generally more unwell. So who should not take this medication, or what are the contraindications to liraglutide? So the first contraindication is if you have a personal or family history of medullary thyroid cancer or a syndrome known as multiple endocrine neoplasia syndrome type 2. This is related to the increased incidence of a certain type of thyroid cancer seen when the medication was given to rats and mice in studies. This is why if you have a history of this type of cancer, or you have this condition MEN2 that predisposes you to this cancer, you should not take this medication. The only other 2 contraindications to this medication are if you're pregnant or if you've shown a history of anaphylaxis to taking this medication. So they are the key takeaways that you need to know before starting the medication liraglutide. If you found this information helpful, don't forget to like and subscribe to the channel. And if you're interested, check out this other video I've made on a different weight loss medication to see some of the other options you may have for weight loss.